So with my first video, I did make some mistakes. After I did her assessment and her vitals, I'm going to make sure that I also asked her about her pain. See if she had any pain. Miss Blossom, do you have any pain? No pain, just a little tightness in your chest? Okay. So I'm going to make sure to do that. And then also too with my IV, I had did just a normal hanging up an IV, but the order was a piggyback. So I want to make sure that I do get her medication, the TPA medication, as a piggyback. So after I did my check, make sure that I grab the right medications. I'm going to come in her room. Hey there, Miss Blossom. So the doctor did order you some medicine, okay? It's called a TPA. It's going to help dissolve that blood clot, okay? I'm going to make sure that I checked her allergies. I'm going to make sure that I check her wrist bracelet. Make sure I do have the right patient, the right medication, the right dose, right route. Like I said, it was a piggyback. So I want to make sure that I check that the medication is compatible with either normal saline or whatever else I may be hanging up. I checked that it is compatible. So I have my normal saline, my tubing is nice and primed already. So I would have this hanging up on the IV pole, but I would make sure that the saline is lower than the medication. So this would be hanging up. I would also, before I do this, also make sure that wash my hands, and I'm going to check her IV, which her IV was good. Had already checked that. No swelling, no redness. Her dressing's nice and dry and intact. Which I'll go ahead and clean off her hub. Unclamp, and I'm going to flush her IV. So as I'm flushing this, I'm going to make sure that her IV doesn't leak, is not infiltrated. So her IV is good, no tenderness while I flush it. Go ahead and lock that. So you always want to make sure your IV is working before you set up your medication, because if the IV isn't working, you want to make sure you get a new IV in before you had already primed your medication. So like I said, this is all nice and prime, hanging up. And then I have the TPA medication. After doing the calculation, I'm going to be giving her the 66 milligrams over an hour. So I have this in here. I'm going to make sure that I spike my bag. And then I'll make sure that I prime my tubing with the medication that's in the bag. And then I would hang up this medication higher than the normal saline. And then I'm going to find the hub that is closest to the top, or furthest away from the patient. I'm going to clean that off. And I'm going to connect those two. So I have those white in. I would hang those up. Like I said, the medication would be higher than the normal saline. I would make sure that I primed, both tubings are nice and primed. I'm going to set my IV channel, make sure that I set this medication to run over for the next hour. So I have that all set up, put this into my channel, and then I'm going to grab another alcohol swab. I'm going to clean off her IV again, clean that hub, and then connect those two. And those are connected, and I would hit start. And then I would also stay in the room, like I said in the previous video, stay in the room for the hour, do my Q15 vitals and neuro check on her. I also want to make sure that I grab my stickers, and I want to time and date my IV bags and my tubing. That way I do know when I started it, just in case if I lost track in time. I do know what time I started and what time it's going to end. So I would make sure, put the stickers on, my bags. I would make sure that I document the correct format, time and date, document what medications I'm giving her, how I'm giving it to her, the dose, the amount, the route, and then stay in her room for the next hour. Yeah.